So all panelists, hi.
Are you able to hear me?
Yep, sure can.
Okay. Hi, Josh.
Hi,
Hey,
Vicky.
I want to
Yes.
introduce myself. I'm Vicky Ravis, one of the co-directors. I just wanted to say hi. I've been listening to your background talk
Oh,
about
okay.
relocating and, delighted to have you on board, and I'm looking forward to hearing what you have to talk about today.
Okay. Thank you. Nice to meet you.
Nice meeting you. I have the advantage of not being on video, so I could just kind of sit back here and relax.
Okay.
Hi, Jed. This is Bei Wu. Can you hear me?
Yes.
Yes, I'm another co-director here at the NYU Aging Incubator. Thank you so much for speaking at this event.
My pleasure. Thank you for the invitation.
Thank you. I also actually forward the flyer to one of your Chinese outreach manager. Ask her to distribute this flyer.
good. That's great.
To Beijing?
Excellent.
Yes, Wei Jing. Yes.
Yeah, Beijing.
So
I
Jed,
just met at one of the fundraising event earlier.
so Jed, you're
Great.
international now. It's an international conference.
Yes.
So what do you think? Should we start? Natasha, do you give us the, on your marks?
Yep. You can start. The meeting is being recorded.
Okay, and we're gonna run this for up to 60 minutes. We'll see what happens with questions and feedback. And I think I have my chat thing sitting here, so I should be able to do this. Okay, so why don't we get started? Jed, thank you so much for taking the time to be with us today, and greetings to everybody who's on this Zoom meeting. We hope that everybody's staying safe and doing well during these obviously very uncertain times. So if this is your first time hearing about the NYU Aging Incubator, I want to tell you a little bit about our initiative. We were first established in 2017 as one of NYU's 3 university-wide strengths, bringing together faculty and students from all disciplines who are involved in the study of aging and its myriad of impacts. And our primary goal is to keep our NYU community informed and up to date on such matters as research, educational activities, events, and services for the aging population. And in addition, we are striving to provide support for the development of innovative and interdisciplinary research, policy, and educational endeavors to improve the health and well-being of older adults. So on behalf of the NYU Aging Incubator team, I'd like to thank you all for joining our webinar today. My name is Joshua Chodosh, and I'm one of the 3 Aging Incubator co-directors, along with Bei Wu and Vicky Ravis. And I'm really pleased today to introduce our guest speaker, Jed Levine, who's a well-known leader of Caring Kind, which is New York City's leading organization on Alzheimer's and dementia caregiving. They've been at it for over 40 years with experience and run by a professional staff. Caring Kind offers both individual and family counseling sessions with licensed social workers. And they have really an impressive and vast network of support groups, educational seminars, and training programs for early stage services, as well as a very innovative wanderer safety program. They work with many community partners, myself included, to develop information, tools, training to support individuals and families affected by dementia. So thank you, Jed. I would just tell the folks who are listening, please submit your questions through our question and answer section, and we'll answer as many as we can towards the end of the webinar. So without further ado, I'd like to give Jed a few minutes to introduce himself before we jump into our discussion. Jed?
So thank you, Josh, and thank you everybody for having me and inviting me to present this afternoon. I'm the president and CEO at Caring Kind. I've been on staff actually for 30 years, and I was a volunteer there before, so I have a long history with the organization, seen a lot of changes, a lot of growth, and a lot of program development to meet the needs. And our basic mission is to meet the needs of families who are caring for a relative with Alzheimer's or related disorder. And as Josh said, we do this in a variety of ways. Our approach has always been, I think, a very human to human approach, recognizing that Alzheimer's is a profoundly human disorder and affects in so many ways what it means for us to be human. Our ability to communicate, to function independently, to reflect, and to be self-aware. So many different aspects of what we understand to be human. And I've always felt that it requires an equally human response. And so, although we use a lot of technology, and we're growing in the way that we use technology, certainly now, we're forced to, but even before that, we've encouraged the innovation in technology to help caregivers and to help people with the disease. Let me also say that we do have a small program for people who are in the early and middle stages. And actually, back in 1990, I co-led the very first support group for people with dementia, which I did for about 10 years. So they're at the core, they're at the kind of the center of what we do, but often that family caregiver is their needs are not recognized. And so many of our programs, most of our programs, are geared to providing information, guidance, support, and helping people navigate this very complicated system of long-term care that we have in this country, and particularly in this city, and to help families come to terms with and understand and reflect on their role as a caregiver and their needs as a family caregiver. Often it is neglected. People are often asking how the person with dementia is. Nobody's asking how you are, who's taking care of them. And remember that many of our caregivers are older adults themselves. Right. Either the spouses or even the children can be older adults. And so they have their own needs. They're coping with their own aging process. And nobody had been trained to be a caregiver. And so what we try to do is to give people the tools, the support, and the psychological kind of support, and the emotional support, and the counseling, kind of psychosocial counseling and supportive counseling to help families get through this.
Yeah. Thank you, Jed. So, I mean, obviously what's really front and center is this COVID pandemic, and we've heard, from you now a lot about what you do, and certainly serving this very large community of caregivers and persons living with dementia. I think it would be really helpful for listeners to learn about what your organization is doing, in light of this pandemic and how it's changed your day-to-day operations.
Yeah, well, it's changed our daily operations a lot, actually, and it's kind of helped us that we focus on our mission of providing that kind of critical support. Caregiving has never been easy. And I think and also remember, this is a long-term disease. So people are not facing, getting over a broken hip in rehab in, let's say, a year. We're talking about the long term. And it's daunting. And there is, often in caregiving, there is the feeling that no matter what you do, it's never enough. And caregiving is also very isolating. Families report that other family members, friends have pulled away. They're not comfortable dealing with the person who's now confused or disoriented or not behaving in the same way that they did before. And that isolation is only compounded by the current stay-at-home order, by the confinement that's being mandated. And so family members are being put in a position where either they are caring for their relative and living with them, and there's no relief. It's this unrelenting job. And remember, everybody is feeling the increased anxiety and uncertainty about what it's like to live in a world where there's COVID-19. There's no real forecast about when this is going to end. Only increases one's anxiety. And so there is a real need to help counteract that. And so our programs, which were very often very in-person, And our trainings were in person, the education meetings were in person, our support groups, we have 85 support groups, were in person. They've all now transitioned to either telephone or video chat like this. And it's been really successful. And I think especially in the support groups, although I will tell you that some of the support group members and leaders are anxious to get back in person because, you know, we're all, you know, as human beings, we're a social species and we function in groups, and there is a need, a real human need to connect with each other. So we can do that through the video cam and through the web, and it's successful, but it's not quite the same experience, but it's extremely valuable. And so support group members are telling us that it's sometimes hard to find time, not the time so much as the space, because if they're living with somebody,
Sure.
that person with dementia might want to be right with them when they, you know, so we're encouraging them to find a space, go into the bathroom, go into the hallway, go into a stairwell, someplace where you can find some space alone. Our education meetings, and we do a lot of education, and I believe very strongly that there's a lot of misinformation out there about Alzheimer's and dementia care, and especially within various cultural groups. There are certainly cultural myths about that have to be, corrected, so that people really have a good understanding of what this disease and what are the tools you need to help your relative. So the education meetings are now being being provided online. And actually next Monday night, on Monday the 11th, we're having a meeting for family members talking about what to do when there's conflict in the family around dementia care. And it's very common, you know, where an adult child says, I really think, you know, dad should go to a nursing home, and mom is saying, I promised him I'd never put him in a nursing home. And so there's real conflict, or there's conflict or jealousies, or there are all kinds of issues that can happen in families. We have a wonderful family therapist and psychotherapist who knows dementia care very well, who will be presenting this information to families on Monday in a webinar. You simply need to call the helpline, which is 646-744-2900 to register. And again, all of our services for family members are free of charge as well. But we do a legal and financial planning seminar. We've had the elder law community really step up and doing some webinars and some recorded sessions for us as well. And we do a program called Understanding Dementia, which kind of outlines the fundamentals of Alzheimer's and dementia care for families that are new to the disease or haven't had that opportunity before. So the education meetings have all been moved to online sources. The trainings, we're in the process of doing that because we do a more in-depth training for family caregivers, so really building the skill of caregiving, understanding the unique needs and techniques in communication, in providing engagement for the person with dementia, and in self-care. How do you take care of yourself? And I'll talk for a moment about that in a minute, just because I think that's even more important in this the time of confinement and restricted resources and supports that are available in the home for family members. Many of we also work in the community, do a lot of community outreach in the Latino community, the African American community, and then the Chinese community, the LGBT community, and then now in the Orthodox Jewish community as well. We have a social worker. So all of their work is now being done remotely. They're not actually meeting with people in person. They're doing it through the phone and through webcam chats. So there's a lot that we've had to do to kind of morph. One of the programs, which is our beginnings program for people with early to middle stage. It's a socialization, activities program, wellness, exercise, music, meditation, and where people met in person. And that's a program where which we suspended pretty early on in the COVID epidemic. We were, I think probably March 12th was the last day or the day that we canceled that program until further notice. But the two facilitators have put up materials online. So that's something else that we've done, is that we've put a lot more materials online. So, you know, you're welcome to go to the website. It's caringkindnyc.org. And you'll see a box that says COVID-19 resources and activities for families and family caregivers. And so the beginnings staff put up a list of, you know, recreated a beginnings program. There's exercise, there's music, there's a cognitive stimulation program that the family caregiver can do with their relative with dementia in the home. So it kind of recreates the experience. So that's been very helpful.
So
and also,
go ahead.
Go ahead.
No, I was just going to. Go ahead. I interrupted you. I was going to ask you something specific, though.
So the something that we get asked a lot, and I think a real need because people are not going to these adult day programs, they're not going to their senior centers. There's a lack of interaction with other people, is that we've put a lot of activities online. And one of our dementia care trainers, who does a wonderful job training direct care workers, home care workers, and also family members, her name is Nancy Hendley, has put up a series of activity videos that families can look at, get ideas. They're creative, they're fun, they're joyful. She has, you know, and it's all the stuff that you have at home. You don't need special equipment to do it. And there's simple ideas, but for people with dementia, and again, depending upon where they are in the disease, because it's hard to talk about this as one kind of monolithic group, but for many people, things like sorting, organizing, writing, cutting are activities that they enjoy, that are repetitive and that are kind of soothing and give some purpose to the day. So that's something that we've done, is put up those terrific activity videos.
I think, you know, in addition to, you know, learning a lot about how you all have, you know, really tremendously pivoted, you know, and using a lot of your, you know, the wealth of resources you have and the wonderful skills that your staff have to continue to do the work you're doing. I think one of the things that I imagine our listeners are really interested in hearing about is what's changed out there. You know, what changes have you seen in your caregiving community from the conversations that the staff are having as compared to even a month ago?
You know, I've been talking to the staff a lot about this. I think the major change is that there is an increase in anxiety. People, and again, as I said, caregiving was never easy, and people are often fearful and afraid that they can't do it. It feels like a monumental task at times, but adding the worry about the virus. Am I going to get it as a caregiver? And if I do, who's going to take care of my relative? My daughter lives across town. She's not coming to visit me because she's afraid of bringing the infection to me or her dad. And or what happens if my person with dementia gets it? And when that happens, it's much harder for that individual to comply with the social distancing, with the hand washing, with wearing a mask. If a caregiver comes in and is wearing a mask or a face covering, he might not recognize her.
Right.
And so we've come up with tools and techniques for how to counteract that. You know, bring a picture with you, wear a name tag, speak loudly so that your voice might be recognized. But again, you know, people, and again, it depends upon where they are in the stage of the disease. People who are a little more advanced, not able to recognize somebody on the tablet as as a family member. So it's tricky. So I think there is an intensity, a greater intensity of the calls. I'm hearing from our helpline staff and from our social work and dementia care specialists who speak to the clients that there is a lot more, the calls are longer. People need more reassurance. They need more kind of practical tools. And they also need more reminding and more tools about the importance of self-care. And as I often say, self-care is not selfish. You really have to make yourself the priority. And so one of the things that we're, helping families do is, helping family members do, is to help carve out some time so that they're not in that caregiving role or in the caregiving head 24 hours a day. Take some space to get away from the caregiving role. You might be in the same apartment, but if you can do something to escape from it, read, watch, a silly movie, do something that is fun and nourishing, connect with others. So the need, we're hearing this very much, there's more, I think, a greater level of desperation in the calls, and combined with the worry and the fear, there's this kind of almost frantic sometimes level of anxiety. So if we can help give people the tools to help calm themselves. And a lot of these are the basic kinds of things that, we always encourage family members to do. Keep to a routine, exercise, eat well, make sure you're sleeping well, all of those basics. This is not a time to deny yourself. If you love a piece of chocolate, go for it. And to carve out some time and to connect with others. And this is where those support groups become really important. So I think we are, even though we've always promoted the support groups as a really important tool to provide community and connection and engagement for caregivers who are often alone and feel like they're the only ones doing this, it's, so much more important in this environment where we are all isolated in our homes. And the support groups are, accepting new members, even in this remote provision.
And, obviously as we're doing right now, we've all moved, full force into an online community, if you will. Mm-hmm. And so I can only imagine that not everybody in your community was an online user, at least prior to this. And so what are you all doing to alleviate some of those barriers in terms of people having the same kind of access, kind of a democratization of resources, if you will?
Mm-hmm. Well, I'll tell you, it was a big transition, I think, especially for many of the support group leaders as well, who are often older adults themselves, retired social workers or psychologists or psychotherapists who also might still be practicing, but also for those members. So what we did actually was provide some technical support for the support groups to do that, and we do that for our webinars as well. So we have one of our we have our IT support guy available to answer questions and to help people navigate. We use GoToMeeting or Zoom. There are many different platforms. But we find also that many older adults are very familiar with FaceTime, and they can do that with their families or children or grandchildren pretty easily. So I think no matter what platform it is, it's important for them. We also made sure that all of our staff had the resources and the either laptops, and also had access to all of their information and files in the cloud. So we were, we had already kind of morphed to the cloud, but now everything is there. So as an organization, we had to kind of take that next step. Let me just say, one other group who is part of our constituents are the home care workers. We do a lot of training. We have a 45-hour dementia care training program for home care workers. Again, remember, this is a population that is primarily an immigrant population, for the most part, not well educated, and people who make very little money. So one of the issues for them, as we think about putting the training online, is do they have the equipment? Do they have the data plans? And can they afford the data to be online for 2 hours, 5 days a week or whatever it might be? So there are multiple considerations that we, hadn't thought about before. So, and we keep, thinking about what new things do we need to do and to reach more people and to have those services, but in some ways the phone still works, and our helpline calls, the social work services are done by phone. The dementia care specialist call, somebody's having a behavioral issue or wants to talk about activities, our dementia care specialists can provide that guidance. So, the phone is still a good basic tool.
So, I can speak from, personal clinical experience that we've seen a significant increase in what we would call encephalopathies from this virus. The virus is, directly affecting the brain like it is many other organs in the body. And not just because it puts people at increased risk for stroke, because it does affect blood vessels and blood clots. We've seen tremendous amount of this. But so so the brain is at greater risk, obviously, with this pandemic. And how has, your organization been impacted by this specific kind of concern?
We have not heard as much about the kind of encephalopathies and the brain being affected by the virus. What I'm hearing more is that, especially in the older is that the onset of symptoms is perhaps atypical.
Oh yeah.
That there's not generally a fever, or it's not a very high fever.
Right.
That again, when people are cognitively impaired, not in touch with how they're feeling and can't express how they're feeling. So they might be experiencing symptoms, but not be able to communicate that to their caregiver. And so what we're seeing is a more rapid, what looks like a more rapid onset of symptoms and a very rapid cascade into severe illness and death. So
yeah.
I've seen, families, one home care worker reported that she was taking care of a couple, which she had been caring for many, many years. The gentleman was 96 with dementia. The wife did not have dementia. She was 94. He developed the disease, and within hours after being taken to the hospital, he died. And then the wife became ill, and within days, she too died. And then the home care worker developed the disease. She's okay, but she brought it back to her family. And so she had other relatives who had to be on respirators. So there's kind of this ripple effect that we're hearing about.
I think this is part of the problem, in the absence of testing, not knowing that people are in fact infected. And it is actually not specifically, it's so unusual to the virus, I think we understand, because just like somebody gets a pneumonia and they may have had that pneumonia for a week, but they're not, quote unquote symptomatic. We see that a lot in people with cognitive disorders, and whether it's directly because they're not able to report their symptoms or they're just not having those symptoms, because their brains are working differently, that by the time they present, they're really, really sick. And when we look in the hospital, we don't see large numbers of very elderly people in the hospital. And I fear that the reason for that is they're not getting there. They're being impacted and to great degrees, as we've seen certainly in our nursing home populations, but they're not getting there. Just as you say, your experience of people becoming symptomatic and then, dying very shortly after, maybe have been infected for even a number of weeks. With all of the obviously social isolation for everyone, and I would imagine, and for all the reasons that you've described, that there are probably either new or greater exacerbated, day-to-day caregiving problems that have arisen from this from this crisis. And so, what, in addition to the things you've talked about, particularly for self-care, what other solutions in terms of these day-to-day caregiving problems, or new solutions do you think have arisen out of this crisis?
It's that's an interesting question. I think we are looking at what more we can do about providing these supports and sources of information and guidance remotely. So that kind of is allowed us to kind of take that next step that I think we would have gotten there anyway, but this kind of accelerated the speed. I think for family members, I think many of them are recognizing that, and we've always said this, you don't have to do it alone, but people who are following through and allowing and finding creative ways so that the friends and neighbors and family members can provide some support without actually being there in person. For example, a neighbor might be able to help with food preparation. For a caregiver who's taking care of her elderly husband, she's elderly, he might need help dressing, he might need help toileting, he might need help getting, grooming and getting his teeth brushed. And after you do that, and then you make breakfast and you clean up and you have to have shopped for that, it's exhausting. So if somebody can pick up a piece of that, and so we're seeing kind of neighbors and friends and family kind of stepping in and saying, look, let me take care of the shopping. You don't have to do the shopping, Mom. I'll do it. I'll bring in the groceries. I'll drop them. We'll do a contactless delivery and or food preparation. And there's been, I think, greater dependence on the delivered meals through Meals on Wheels and through God's Love We Deliver. And certainly through the City Department for the Aging, which has really stepped up their food delivery and access system. And not only for older adults, I think, but for children as well. So finding creative ways, and also ways, and I heard about this the other day that I thought was wonderful. People still want to have meaning in their life and purpose. And there was a person with dementia and her caregiver who wanted to do something. And so they wrote cards that were going to be delivered to the hospital that was in their neighborhood. Just thank you cards. One, it was a great activity, but it also was something that just wasn't the activity for activity's sake, which is okay, but doing something that could then be a more, have meaning and make people feel good about themselves. So I think people are becoming, tapping into their own creativity and their own resilience, but it's tough because, as I always say, unless you've done this, unless you've cared for somebody with dementia and now you're doing it 24 hours a day, you don't know how exhausting it is, how draining it is, and how never-ending it is. And I think one of the issues is just finding some way to relieve the monotony, because one day is exactly like the next, is exactly like the next. So encouraging people to do some of the cultural activities that we do, which we also have online. Can't go to the museums now, can't go to the botanical gardens. But if you go to our website, you'll see a whole bunch of really interactive and fun activities. So you can set that up, set the video up for your person with dementia, and that caregiver can get a break.
That's great. You talk about people coming together and communities coming together. To what extent are you seeing, it would have to be known probably on an individual family-to-family basis or a person living with dementia basis, but to what extent are you seeing new people coming into the helping realm, or new communities forming around this who perhaps weren't really engaged before? Are you witnessing this at all through the work of Caring Kind?
I'm not. I'm not hearing that as much. I think that there are new people who are doing it. I think there are we've always had kind of a cohort of young adults who've always been very engaged and want to do something. Either they have a parent or a grandparent with the disease and they want to help out. So I'm not actually sure that I'm seeing new communities kind of stepping up. You know, one of the things we've often worked with school children and high school age and others. But again, they're also kind of remote at the moment and dealing with their own remote learning. So it's not as easy, I think, to access that.
Okay. And, you know, you're talking really, we've all experienced this. You know, you think that you're now on some form of a lockdown or stay at home, and you know, life got a lot quieter because you don't have as much, there's not as busyness around you. But I know everybody I talk to is busier. And certainly what you're describing is a very busy organization, and one that seems to be, you know, working very hard with a lot of additional uncertainty and obviously increased loss for probably people in your own, you know, in your own workforce with your own, you know, within Caring Kind. And so obviously a huge emotional toll. And what is your organization doing to support your staff?
No, that's a good question, and I appreciate it, because the staff are exposed to, as you said, a lot of loss, and I think to their own feelings of helplessness around this. And one of the things that I try to do, and we are doing some very concrete things to help support the staff. But I think one of the things I can do is just remind people that even though we don't always have the answer that people want, the value of being there to provide that listening and supportive ear is enormously valuable and welcome. And it helps people, it alleviates the callers, the clients' own kind of emotional tension. It's a release for that tension. And it's in line with our kind of one of our basic approaches or principles, which is that because people are so filled with a lot of very strong feeling, often you can't give people information because they can't hear it, because they're so filled with their own sense of either sadness, profound sadness, sometimes rage, sometimes guilt, sometimes profound love, sometimes a combination. Usually it's a mix of all of those. But if you give people a chance to process that, and you do that through talking. So, you know, the value of just talking to somebody else who understands what you're going through. So reminding staff that what we do simply by being there and helping people understand their experience, and then give them the practical tools and suggestions. That's one thing. Also, we have kind of stepped up the supervision. So we have formal supervision with a clinical supervisor for the frontline staff who are working both in the community settings remotely, and doing the teaching, the training, and the online kind of supportive counseling and the helpline. And that's really helpful. And also, I do that with a clinical supervisor, and then I provide supervision twice a month as well. And one of the things that I also remind our staff is the same thing that I remind caregivers: maintain a routine, create boundaries around the work, so that you're not working, you know, because you're working at home, it's hard to maintain those boundaries. But it's very important that you're able to do that, and not have the, you know, if you can have a specific physical workplace to do that, that will be helpful, because then that place can contain all of that emotional, a place for that work to take place, and you don't have that in the rest of your house, which I think is important. Maintain a routine, eat well, take care of yourself, exercise, I think is so critical. And I know personally, I've always worked out, but even if it's a 15 or 20 or, you know, half-hour workout, I'm doing something every morning, and it just makes me prepare for the day. It's really helpful. Breathe. Very simple. but especially as things are escalating. If you're on a call with somebody and you're feeling more helpless or more concerned, remember to breathe. And as you know, deep breathing helps regulate the amygdala. So it kind of tones down the emotional heat in a way. And I remind people, it's a very easy thing. So caregivers can do it, our staff can do it. I remind everybody on the call to just simply take a moment, stop, and breathe. And if you have a practice of prayer, of meditation, of being in nature, something that is restorative, to do that practice, that will help. And, you could start with, 3 minutes a day and build up. But I think that's really, it's all part of self-care. So kind of giving people those tools. And as I said before, I think this is not a time for denying yourself. And if you like to have a glass of wine at the end of the day, go for it, this is the time to reward yourself and to find life's pleasures and to enjoy them.
So are you doing, I know a lot of organizations, and certainly within our trainee environment, which is, enormous stresses, we're having in many divisions and departments, nearly daily happy hours, virtual happy hours. And so is your staff as a whole getting together at all to kind of see one another?
They are.
So what's happening with that?
I think that's really important because we're so used to working together. As I can run into somebody's office, or if there's just this kind of the daily dialogue and communication that we're missing now. So we have kind of formal staff meetings, and we have departmental meetings, and I meet with staff individually over the web chat. And I think and they are meeting without me as well, which is great. So they are doing that, and I encourage it. And it's, getting that sense of, connection and community and collaboration that we don't have when we're sitting alone in our apartments or rooms doing this work.
Great. So, we're all talking about, the new normal, and I think it's affecting us personally, but also professionally. And so what are the new strategies on the horizon for Caring Kind?
I think there are several things that we're looking at. One is blending some both in-person and online activities, that it doesn't have to be all or nothing. And I think, and again, we don't know when this is going to happen.
Sure.
So we're dealing with a lot of uncertainty, and we're trying to figure out kind of, what it looks like and what the workplace is going to look like, and how we manage perhaps with smaller numbers of people who are allowed to be in the office at one time. So I think we're looking at kind of innovative models of how we're going to do the work, which include, more virtual and online activities. And we're partnering with many different organizations. And so doing these webinars like with you at NYU, and getting our message out that way. We're working with the cultural institutions and bringing those cultural institutions onto our website, so that we can provide links to the families who would like to participate in arts and cultural activities. I'll tell you, if you haven't seen our virtual tour of the Brooklyn Botanic Gardens, it's 20 minutes of just beauty.
Is that on your website?
Yeah, it's on our website. It's on the COVID-19 resources page.
Fabulous.
And it's absolutely beautiful. So the cherry blossoms, it's just absolutely, it's actually a 4-season tour. So you see all of it. They've been a long time partner with us. So in our Connect to Culture program. So kind of thinking about how we can do this, working with our community partners and connecting with them. I know that our Wanderers Safety Program, which provides identification for people who are at risk of wandering, there is a greater demand for people to enroll in that program. And I think family members are more concerned now about their relative getting out when there's not as many eyes on the street to recognize that somebody's out there and wandering. So, so we're seeing an uptick in the number of people who are enrolling in that program.
Oh, interesting.
Yeah.
That's really interesting. What do you see for the future of caregiving in this new normal, which has obviously been tremendously disrupted?
I think one of the things that has this whole pandemic has shown a light on is the value of healthcare professions, and included in that is the home healthcare worker, and the need to provide adequate PPE for that person who's providing care for somebody in their home. And how do we make it, the issue of providing home care during this time is very complicated. I think we are, family members, there'll always be a need for home care. And there often is a great reluctance to allow a home care worker in, and it might take some work to educate a family member about why it's important and how to manage that relationship. So that's even more complicated now that we're dealing in the time of this virus.
Sure.
So I think that's something that's been kind of highlighted, and also the issue of residential care.
Yeah.
Now, we know what's happened in nursing homes, and that nursing homes are truly hotspots. And frankly, it should be no surprise, because who is in nursing homes?
Right.
But people with certainly with cognitive impairment, but they also have multiple coexisting chronic conditions.
Right.
And by the way, people with Alzheimer's disease are I think 5.5 times more likely to have a chronic coexisting condition,
right.
or 2 or 3. So clearly,
Absolutely.
these are people at greatest risk, and it's kind of shown a spotlight on the kind of challenges for nursing home providers, and the need to increase staffing and training, and for infection control. Even though the federal government, I think, is trying to roll back some of the regulations around infection control, which is totally counterintuitive and counterproductive, especially at this time.
Yeah. So Jed, we have some questions from the audience that I wanted to relay to you. So one question was, do you have an occupational therapist on staff, and what are the professional backgrounds of your paid staff?
Mm-hmm. So the paid staff are primarily social workers. Some have degrees in community health education, and through schools of public health. We don't have occupational therapists on staff. We have contracted with occupational therapists and with other kind of music therapists and art therapists and others to provide some programming. So we're not a rehabilitation center, but we have access to. We also keep a database of occupational therapists, physical therapists, some who will go to the home, and other healthcare professions that are helpful in caring for somebody with dementia.
Okay. So another participant asked if you could please address the impact on caregivers and loved ones in long-term care facilities who can't see each other in person due to this situation.
Thank you. I meant to talk about that, and I think it is, it's heartbreaking, actually. And the anxiety of not being able to visit. And for somebody with dementia, that family caregiver visit is not just a social visit. Often that person needs a lot of hands-on support that many times, or often, the staff of a nursing home are not going to take 2 hours to help feed mom. But the daughter might be going every day at lunchtime to help feed mom, to just check her out, and to have that hands-on connection. So I think helping families, and I must say some nursing homes and hospitals have been very creative and in helping to create a connection, either through the phone or through a tablet or a FaceTime connection. And actually, one of my a consultant who works with us, her mom was in hospice the last couple of weeks of the COVID epidemic, and actually for several weeks before that. And she was so frustrated that she couldn't see her mother, and she and her sister visited daily. And but she said the staff were really wonderful and provided this kind of loving touch and communication with the mother, but also with them. So they felt supported and they felt connected. But I know
That's
for
great.
many families, it's really difficult.
Yeah, really difficult. That's great. And so I'm sure you must hear this a lot, but another participant, is asking whether you could comment on the concerns and, or worries that caregivers may have when they're not able to be with their loved ones when they die if the person with dementia develops COVID-19.
Mm-hmm. Yeah, it's, it is very, it's profoundly sad. I mean, a death of a loved relative is always sad, but to not have the opportunity to kind of physically be there and to say goodbye and to have that, and also to have the support of other people around you. So, and I think that's, there's great comfort in being with other people at this time of such incredible sadness and loss. I think that, and then not being able to hold a funeral in the same way. And again, we've had situations where funerals have had to be postponed simply because there's been such a backlog. And we're finding a funeral home that will be willing to take and to have the service. But you can have maybe 10 people who are socially distant in a chapel. I think, again, people can use the online connectivity to provide some semblance of support, but there's nothing that's going to replace that hug, that physical, comforting. Just like when we're, when we're very young, you want to be held and
Right, of course.
rocked and comforted, and that needs to happen. So I think it's going to have, emotional consequences kind of beyond this period of time, and I think it'll, I speculate that it might create even more complicated grief. The grief after a person with dementia dies is often more complicated because the relationship and the close attachment in the caregiving relationship that gave meaning to that caregiver's life is no longer there. And then not being able to resolve it and to process it and to have ways to, get the kind of communal rights and supports that we normally expect after a relative dies. I think it's a huge loss.
That closure is really important.
Mm-hmm.
So, Jed, before we end, I noticed one other question. I think at the very beginning of this, it's obviously a very simple one, but at the very beginning, you mentioned a phone number and wondered whether you would slowly repeat that again for our listeners.
Happy to. So that's our helpline number, and it is 646-744-2900, 2900. Let me repeat that. It's 646-744-2900. And you can call there for information, for access to all the online. You can take a look online, but for all of the education programs, if you want to sign up for the Monday night program on family conflict and managing family conflict, recognizing it and how do you resolve it, you're welcome to do that. That's at 6 o'clock on a webinar on Monday. and also to sign up for any of the legal financial planning seminars, the Understanding Dementia seminars, and the other education programs we have, which are also available, by the way, in English and Spanish and Chinese.
Right.
Yes.
Well, Jed, I've always been, since the time that I've been in New York over the last 5 years, I've always been very impressed with all the wonderful work that Caring Kind does and will continue to do, and, equally impressed with your work and dedication.
Well,
And
thank you.
I really want to thank you for taking the time out of what is probably a busy day to spend with us and our listeners. So thank you so much. It really is appreciated.
It was my pleasure. Thank you for having me.
Okay. We'll see you soon. All right.
Great. Okay.
Take care, everybody.
Bye.
Thanks for joining.
Bye. Sure.